Welcome back everyone, my name is Michael Cooley of the class of 2019 here at PCOM-GA ASHP-SSHP Clinical Skills Competition, Example Team Effectiveness and Time Management Review. Just to introduce myself briefly, my name is Michael Cooley and I'm the ASHP-SSHP Student Chapter President here at PCOM-GA for the academic year of 2017-2018. I'm currently a P3 working with faculty and staff to provide a clinical skills example time management layout for teams, or how you and your partner can work and become more efficient at reading cases and writing pharmacist care plans. Just to repeat, and although it's implied, I'd like to explicitly say that my view doesn't reflect in any way the view of the faculty and staff, the school, or of ASHP. The school has no financial ties or disclosures. This information is not sponsored by ASHP, and for completeness sake, this information is never to be used as medical advice or substitute for a medical professional. This slide is just a recap, but an in-depth look can be found at the Clinical Skills Competition Formatting Review YouTube video. What is the best way to produce a SOAP note? It's really however you want. Just make sure you follow a consistent format throughout all your SOAP notes. Also, please leave your comments and concerns in the comments below so that we can improve. Here I've provided all the formal references which will be provided at the national competition. However, at the competition you will be allowed one iPad loaded with Lexicomp and unlimited use of the internet. I do advise that you use all resources at your disposal, for you and your partner. This is the more crucial part of the video where I use teammate number 1, the Pharmacist Care Plan, and teammate number 2, the Evidence-Based Medicine, to break down the clinical skills competition workload. This is an example, and extreme emphasis on example, but I will show you roughly how my partner and I break down each case. The Pharmacist Care Plan, or the PCP, will write down all the materials, while the EBM, or the Evidence-Based Medicine, is responsible for finding all the materials. Mentioned on the previous slide, but developing preferences to the references and searches will fall predominantly on your EBM. First, your EBM is going to go through the case and look for the number 1 problem, or the most acute problem. I usually check the patient narrative or the diagnosis found near the end of the case to relay that information to the EBM. After that, the EBM will begin searching the number 1 diagnosis, diagnostic criteria, and the treatment guidelines. Then, the PCP will begin to skim the case looking for abnormalities, as the EBM is looking for all the diagnostic information surrounding it, such as comorbidities, risk factors, and complications to match with the PCP's abnormalities found in the case. At this point, the PCP has all the tools he needs to use his judgment to make the prioritized list, but the EBM should be adding input because this is such an integral role of the PCP. Once the list is completed, the PCP will work to fill out the assessment, and the EBM will focus on the Mr. T of the plan, which, what does Mr. T stand for? That's right, monitoring and therapeutic endpoints, recommendations of therapy, pharmacologic and non-pharmacologic, also with therapeutic goals. This is the moment to review by either exchanging parts or communicating about questionable aspects of the prioritized list, the plan, or the assessment. Thank you. Please leave your comments and concerns down below, and I hope to see you guys again soon. Thank you.